The Metagenics Institute for Clinical Nutrition presents a forum from a satellite symposium at ASPEN's Clinical Nutrition Week 2015, held in Long Beach, California on February 16, 2015. Key thought leaders from clinical nutrition and research discuss microbiome, can targeted support influence health conditions? Participants are Robert Martindale, MD PhD, Professor and Chief of General Surgery and Medical Director for Hospital Nutrition Services at Oregon Health Sciences University in Portland, Oregon. Malissa Warren MS RD Critical Care Dietitian in a mixed surgical and medical ICU and Chair of the Nutrition Support Team for the Portland VA Healthcare System in Portland, Oregon. Fergus Shanahan, MD, Professor and Chair of the Department of Medicine, University College Cork, National University of Ireland, and Director of Research at the Alimentary Pharmabiotics Centre from the Science Foundation of Ireland. Eileen Murphy PhD, Director of Research at Alimentary Health in Cork, Ireland. The session is moderated by Dr. Robert Martindale.
The consumer interest is, I think, probably going faster than the science. You know, it seems, at least in the U.S., I know you guys may have a bit different perspective in Ireland, but it seems like here we're driven many times by patients coming to us with internet reports and things off the internet they read about what are the benefits of these, should I be using these probiotics, when should I use them, how do I use them, and those sort of things. I think that the scientists have sort of lagged behind. I mean, there's certainly, you guys are in the forefront of the science part of it and the data collection. And so I wonder what your thoughts are. Do you think that's the case, or do you think the medicine community has sort of embraced this now and taken it as part of their normal routine?
Well, I think the lay public are remarkably well educated now and find the concepts fairly straightforward, in fact even compelling and intriguing. And there's a general dissatisfaction with traditional drugs as well, because there's so many conditions, chronic diseases, where the drugs are wonderful, but they're not enough.
Yeah.
And patients realize that, and they know how safe some of the other strategies can be, and they're willing to explore it.
You know, even the concept of fecal transplantation, which you would think would be very offensive to the public, before we were even allowed to even look at this by the FDA, at least in the US, people were saying, I want this. I'm demanding this here. I am, you know, and so I think that was what we thought would never be accepted by the public, but has. But I noticed very interestingly in one of your slides this morning, the rise of these inflammatory diseases and these chronic, you know, the inflammatory bowel disease and all the other things you showed in that one slide where they're just going up exponentially. And I think if we can, the public starts to grasp the fact that these will affect not only acute disease, like we've talked about this morning some too, but chronic diseases, then I think it will really take off. I think the question is now we've almost got too much data in the last couple of years since the the advent of our high flow sequencing issue. Now to sort that out is becoming the problem. And which species? And I think your paper your presentation this morning very nicely brought up that one slide to me that was so dramatic was a slide of all those strains of UC or of Lactobacillus salivarius, and some having effect and some having no effect.
Yes.
It was quite amazing to think these are all the same species, you know, with all those effects.
And I think that actually is something that we have to work on in communicating to the consumers as well, because it is a little bit confusing that lactobacilli, that they're all individual, that you can't extrapolate from one strain to a group of strains. So I think there is a little bit of messaging that we need to work on for the consumer, because I think there's a lot of marketing out there as well that is trying to leverage off the science, and they may not have the science to do so.
On the other hand, you wouldn't take, in analogy with pills, you wouldn't take pills that are used for prostatism, you wouldn't use those pills for your asthma. So if pills are so different, why would bacteria not be so different? It's like it's absurd to think that they'd all be the same.
Right. I mean, even like if you want to take a probiotic, if you have an infection, which antibiotic to take? It's a similar thing as, we wouldn't, if we got pneumonia, we wouldn't take just any antibiotic off the shelf.
But even then, I think it's confusing because the products that are out there commercially don't tell our patients what strains are in them or what those mechanisms might be for those strains. So I think regulatory-wise, we have to get these companies to list the strains on their products.